Hi, this is Jim Paoletti, pharmacist, fellow in functional medicine. I want to talk to you a little bit about treating the cause of the symptoms and not just treating the symptoms with respect to hormones. Let's say you have a patient come into your office, a 47-year-old woman who has the following chief complaints. She's gaining weight, she's not sleeping well, she's more irritable, and she's starting to have some irregularities in her cycle. Most people experience with hormones are going to think right away in the back of their mind, oh, this woman is probably lacking progesterone, because that's the first hormone that usually drops off in its levels. But all the symptoms I just mentioned for this patient, they could all be caused by high cortisol, or maybe low cortisol, or maybe low thyroid function, or maybe she's not metabolizing her estrogens well because of poor nutrition, or maybe it's a combination of those. That's why we take patients' levels and we correlate with the symptoms. We're treating the real cause. Another example is a woman's hot flashes. I mean, for years, medical professionals have been trained. If she has hot flashes, she needs estrogen. Well, that's not true. In perimenopause, a woman's estradiol levels actually go up a little bit. They don't drop off. So if she's having hot flashes and she's in perimenopause, low estrogen is the least likely cause of her hot flashes. More likely, it's low progesterone, which regulates the estrogen receptors and makes the estrogen works right. Or it could be high cortisol, or it could be low cortisol, low thyroid, a number of things. Again, why we have to test if we're going to treat the patient's symptoms correctly. The same things happen with males. With males, the problem is we try to fix everything with testosterone. So there's 2 points I want to make here. If a guy comes in, he's 47, and he's got the testosterone level of a 60-year-old, yeah, you might want to give him testosterone, but my first question is, why does he have the levels of a 60-year-old? Maybe in that patient we could address some things like exercise and sleep and make him make his own testosterone naturally again. The other thing about a male is we cover up a lot of other problems. If you look at the symptoms of poor nutrition, low thyroid, low cortisol, get those symptoms lists out and compare them to the symptoms of low testosterone, you'll see there's a heck of a lot of overlap. And you can cover up those other deficiencies by giving this guy excess testosterone, but you're not helping him long term. We need to address the underlying cause of the symptoms.